Assalamu alaikum wa rahmatullahi wa barakatuh. The article for this week titled as Clinical and Radiographic Failure of Non-Surgical Endodontic Treatment and Retreatment Using Single Cone Technique with Calcium Silicate Based Sealer. A systematic review and meta-analysis done by Sabeti et al. And published in the JOE in 2024. This systematic review and meta-analysis aim to evaluate the clinical and radiographic failure of non-surgical endodontic treatment and retreatment for permanent teeth with or without apical periodontitis using the single cone obturation technique with calcium silicate based bioceramic sealers, and to compare these failure rates to other sealer materials and obturation techniques. Two reviewers assess the eligibility of the included studies. The eligible studies must include details of the procedures and the types of materials used. The studies must have also a clear definition for clinical failure and radiographic failures. Additionally, a minimum follow-up period of 12 months is required. Review papers, meta-analysis, animal studies, ex vivo and in vitro studies were excluded. For the result from the systematic review, 5 studies were included. Of the 5 studies selected, there were 2 randomized controlled trials, 1 non-randomized controlled trial, and 2 retrospective cohort studies. A total of 739 teeth were included in this systematic review. The interventions of this study were obturation using single cone technique with calcium silicate based bioceramic sealer. The following types of calcium silicate based bioceramic sealers were used in the included studies: endosequence, bioceramic sealer, and biorote. In the 3 of the clinical trials, the following obturation materials and techniques were used as a comparison group: AH plus using warm vertical convection technique and zinc oxide ethanol using warm vertical convection technique. Failure rate for non-surgical endodontic treatment and retreatment combined using calcium silicate based bioceramic sealers and single cone obturation technique was 6.8%. And for a second analysis was conducted on the 3 included clinical trials to compare the outcomes of the intervention, calcium silicate based bioceramic sealers and single cone obturation technique, and control groups. This analysis found no significant difference between the 2 groups regarding clinical and radiographic failure of endodontic treatment and retreatment. So the conclusion from this systematic review and meta-analysis demonstrated that the single cone obturation technique with calcium silicate based bioceramic sealer provides similar results compared to other obturation materials and techniques. Thank you.